minutes early, but I think we're gonna have some public comments, so we might need the extra 2 minutes. We'll call the meeting to order. My name is Emily St. James Robinson. I'd like to welcome everybody here. It's a, we had a meeting earlier in the week and things have changed a lot. These are really uncharted territory for the world of public health and the world of everywhere around the world. So rapidly changing, and we have to kind of morph to fit whatever's going on, which they're hard decisions for us. We have to protect the health of the public. We have to try to protect our community as well as the small business owners in our community. So these are really hard decisions, and the decisions won't be made lightly. And so I think collectively we'll come together and hopefully we make the right decisions. If we don't, we can come back and change those decisions, or I thank the board for coming together at such short notice last week. We had a 6 o'clock meeting, and it was pretty much just a half hour's notice to come together, and everyone came, and I really appreciate that. So we'll start with calling the meeting to order and attendance.
Bukacek,
Here.
Berg,
Here.
Holmquist,
Here.
Larson,
Here.
Nicosia,
Here.
Noble,
Here.
St. James Robinson,
Here.
Skis,
Here.
Waterman.
Here.
Okay, I'd like to start with approval of the agenda.
I'd like to make a motion that we amend the agenda to move item number 7, COVID-19 updates, to directly after public comment and approve the amended agenda.
Second.
Okay, so that was a motion. Okay, and we have a second. Do we have any discussion on that?
I'm making this change to amend the agenda so that we can hear information on the COVID-19 updates before we take action on item number 6.
Okay, we'll have a vote on that. Everyone in favor of amending the agenda?
Aye.
Any nays? Okay, that's approval of the agenda amendment is adopted. Approval of the minutes from the February 20th meeting.
So moved. Second.
Do I have a second? Everyone in favor?
Aye.
Against? Okay, they're adopted then. Okay, we're going to go into public comment now. So anybody who would like to have a comment can take turns coming to the podium. And I will say that during this public comment, we as a board will not comment back and forth. We might ask you some questions, but the discussion will be after. So it's your turn to come and say, introduce yourself for the record and have at it.
Perfect. Hello, can everybody hear me okay? So I'm actually the medical director for the Flathead City County Health Department. My name is Dr. Cole. I'm a pediatrician at Kalispell Regional. And I was hoping to kind of start off the comment here just with a few of my thoughts as we kind of undergo this important decision today. So I feel very sad to have to meet you under these circumstances. This is a very trying time for our community and the nation and the world. But there's no question in the medical community's acknowledgement of this crisis that this is a public health crisis. There's no question about that. With that said, I also do understand the economic impact is devastating for the community, and we have to be able to balance those two issues. But to do this, we need to flatten the curve, and this is something you'll hear from Dr. Jada and Dr. Nelson from KRH in a minute here too. But that's I think a idea that's been passed around through the media for quite a while from healthcare workers. The concern is overwhelming our healthcare facilities so that we can take care of the patients that are sick, and that's what we need to keep in mind as we're discussing this today. If we do not act decisively and quickly, this will get out of control quickly. We know this because this has already happened across the world in Italy. The loss of life and economic impacts will become much worse than they are now. And we know that the virus can easily spread in crowds. So I was kind of looking, it's obvious when somebody is sick and has a fever, and that's how we're screening people at the hospital and the community right now. There's been some studies that have come out recently that have said up to 17% of patients are asymptomatic carriers of COVID-19. So this is the group of people that scares me the most, because they're walking around our community, they're going to our restaurants and our bars, and they're infecting people without even knowing they're sick. We are doing the best we can, testing people and triaging and self-quarantining, but there's no way we can keep up with that. And because we don't know what the true levels of the disease is in the community, we have to take drastic action, and that's what this is about. So, just to finish up my comments here, the President of the United States, just 3 days ago, in conjunction with the CDC, recommended a 15-day plan to slow the spread. So that goes from March 16th until April 1st of the coronavirus. And he did a press conference on this on Monday, but you can find this information easily available. But to sum up just two of the points that were talked about at that press conference is to avoid all social gatherings greater than 10 people. Also to avoid eating at restaurants, bars, and food courts. And in place of that, to use drive-throughs, pickup, and delivery options. So those businesses can still work, but we minimize the spread of the disease to people. So after reviewing all the available evidence, and this changes daily, we are all trying to keep up with this the best we can. But with all the evidence that I've been able to weigh and learn from the experts, from the CDC and the federal government, I think we should follow the CDC guidelines and President Trump's recommendations in the Flathead County and immediately close all restaurants, bars, and public gatherings of more than 10 people. Thank you.
Thank you so much.
Hi, I'm Dr. Jeff Jaden. I'm the infectious disease doctor for Kalispell and the region here. Hi, I'm Dr. Jaden. I'm the infectious disease doctor in the Valley here. I've been in the Valley for about 10 years, former Navy prior to that. I would like to echo the comments that Dr. Cole made here. I think we know that this is a global pandemic. It's been declared a national and state emergency from that. And unfortunately, the respiratory virus is spread from person to person. We now have data that it has the ability to be basically coughed or sneezed into the air and suspended for several hours and be potentially on surfaces for several days. And so you don't necessarily have to have that direct contact. It can be indirect contact from people that you don't know that have been infected from that. We've seen countries that have had really struggled with this and are continuing to struggle with this virus, and we're seeing death rates and mortalities as high as 10% in areas that were not as prepared, and we've seen less than 1% with more what some people would call drastic measures, but I think appropriate measures and things to try to contain this. We understand to some degree how it's spread, but obviously there are people that don't have symptoms and can spread it. I'm perfectly comfortable if I know somebody has COVID-19, I know what I need to do to take care of them, and those are the easy ones for me. It's the other ones that are walking around and spreading it that are hard to contain, and that's the struggle that I think we have to do to really protect our community and to protect our vulnerable populations and things here in the nursing homes, in the dorms, in those close places where they have to be aggregated and things for that there. So I'm in support of the proposal.
I have a question, and I haven't been able to see this, and maybe they don't know it yet, is like in influenza, you're contagious 72 hours before you have signs and symptoms. Do they have any idea if you're contagious prior to having the signs and symptoms? Have you seen that anywhere?
There are clearly people that have been described that had no symptoms at that time, and there were subsequent cases, typically in households and things, where people developed those symptoms that had no other exposures, and so that raises the risk of kind of asymptomatic transmission, where somebody has the virus and is giving it to other people without that. That's a hard group to identify because we don't recommend testing people when they don't have symptoms, because we don't know how often you have to test them then, and if you test them now and they're negative and they get it an hour later, they could be infectious and things from that. We know most people, the incubation period is 2 to 14 days. Most people develop their symptoms within 5 days. But that time frame for the asymptomatic and when you convert over and things, I don't think we have enough information yet as this is emerging.
Okay, that makes sense. Thank you.
Where did the data come from as far as it's estimated that 70% of COVID, asymptomatic COVID carriers are out there? I mean, how could they possibly come up with that?
I can speak to that if you like.
And it's for COVID-19 specifically and not coronavirus. It's not the strains that cause the common cold.
Correct.
I think a lot of it comes from modeling and things. No,
Correct.
we
There's no
clearly
data.
know that the number of cases and things that we're identifying are vastly underrepresenting what the true numbers of cases and things there. So when you base the mortality on the number of cases that we have, we know that there's many more cases and things involved with that. But
But there's no data, it's a model.
Well, no, that's correct about the model. So this is from Euro Surveillance. On February 5th, 2020, in Japan, a cruise ship hosting 3,700 people underwent a 2-week quarantine after one former passenger was found to be positive for COVID-19. A total of 634 people out of that 3,000 tested positive for COVID-19. It estimated that the total number of true asymptomatic cases were 113, which is a total of 17.9%. So this is based off of this 2-week quarantine that happened off of a cruise ship in Tokyo. And this was just published about 5 days ago.
But it's a cruise ship that's a little different than the general population.
It is a closed, so it would be, I think, similar to our restaurants and our bars that have more than 50 people in them, or 10 to 50 people, because it's that crowded space where it's going to be spread.
But there were known cases on it, so.
Right.
And Dr. Jane, the mortality of those people on that, it was, let's see, 0.84%. It was less than 1% mortality on that, according to my data.
yeah, the mortality worldwide has varied, and it depends on how you stratify it based on the age group and those types of things there. In Wuhan, China, if you're over the age of 80, they had mortality estimates of 17 to 20% in those. So clearly comorbid conditions, age, and those things factor into it as well. But also we've seen variations depending on the countries and things that have been involved from those. Within China, probably 5% and things there. We're starting to see similar, if not larger, numbers in Italy for there. In the United States, models and what we're seeing and things are estimating from 0.6 to 1% there, so 6 times more than influenza.
And another way to look at that 20% is that 80% of people over 80 and people that have comorbid conditions actually get through this and do just fine. And the under 80 crowd, the mortality rate's close to 0. So
If you say you infected every one of those people there, but not everybody in those I mean, the entire population of China hasn't been infected that we know of and things there. But we do know, and we've seen a good example in Washington when it got into a skilled nursing facility, the mortality in there was very significant.
And they still have not been able to contain that,
No,
that outbreak?
No, it's still ongoing, and it's infected the healthcare workers and the residents.
Yeah, and that example in Kirkland though is still ongoing. They haven't
Oh,
been
no,
able to
it's not
contain
contained.
any-
but for the under 80 crowd, it's still about 1%, 0 to 1% mortality for the under 80 crowd of people without comorbid conditions, and I think that's significant. I mean, the estimates, yeah.
And then the
Most
other
people
thing,
going to
in-
bars and restaurants are, the 80-year-olds are probably staying home. I went to an event last Saturday, 700 people, people that were elderly stayed home, people that had sick children stayed home, 700 people still showed up. I mean, it's like, those are not the people that are gonna be prone to have a problem with this. It's population based, the
And then
mortality and the risk.
the other thing is the CDC put out yesterday from the morbidity and mortality, MMWR reporting and things there. And you're seeing a lot of it in the press and things. I've seen a number of headlines on things on it today. I think it's preliminary data, but it did suggest that the persons from the age of 20 to 50 had significant rates of hospitalization and more critical illness and things. Now again, there are limited number of patients and things there, but significantly higher in what we're seeing in the U.S. than what's been reported through the global literature. But that's new data, and they're still compiling it. But the ages 20 to 50, a significant proportion of those needed to be hospitalized.
But in the United States, we're only testing people that have comorbid conditions or are over 65. So if that's true throughout the nation, then the people that we are checking in terms of mortality, it's gonna be the people that are at risk. It's not gonna be the people like are in this room. So there's already gonna be a selectively high mortality rate, because those are the only people we're testing.
Well, those
correct?
were the people that got hospitalized.
But those are the only people, at least from my understanding, you know, that those are the only people that the CDC is recommending we test, are people over 65, comorbid conditions, people that are known to be, I mean, that's what the CDC says, people known to be exposed. So if those are the only people we're testing, then it's gonna be a skewed high mortality. It's not you and me and these folks.
I think the virus has emerged relatively late to the United States, so I don't think we can say that with our experience yet. We're clearly seeing in areas, New York, Seattle, where they have been impacted by this virus, and they're having to make PPE because of a shortage of PPE with it. And so I think there's examples of places that haven't done those. I think South Korea really implemented pretty restricted implementation of their approach, and they've had relatively low numbers, and we've seen areas that have not done that, and the numbers are very high. So
But here in the Flathead, we're only gonna be testing the high-risk people, and I think that's what the CDC recommends, and I believe that's what's being done nationwide. So I just think it's important that people understand that. That's the CDC recommendations.
I think the reason that that has been the recommendation is because of the lack of testing.
But it
with
still is the recommendation, so if that's who we're testing, it's gonna have a higher mortality. I think that's important for people to understand.
The recommended testing group also includes those who have regardless of age, contact with a suspected or known case of COVID-19. So
Right,
that does
I
get to some of the
include that.
non-high-risk population.
I
are that
include
being
that.
tested.
Is it fair to say that by eliminating the exposure, like we're trying to do possibly today with this order, that creates less of a chance for these individuals to get this virus? And that's, I think, our goal, is to try to lessen the exposure, because even though these individuals may be not of the age that will get the virus, they could still spread the virus.
Correct.
Is that fair to say?
And I think that's what the flatten the curve. I mean, the example I give to my patients and the things there is, if I give you the task to climb a mountain in a day, there's very few people that are going to be able to sustain that or survive that. If I give you that same mountain, smash it down, spread it out, not have the incline, and let you do it over a year, most people could do that.
And it's fair to say it's kind of an unknown thing here, what we're dealing with. This virus is something new for all of us to try to deal with, and we're just trying to do the best we can to protect our community from someone giving it to us. They may not even know they have it, they may not even get it, but they could spread it. I think that's why we're trying to contain what we can, to try to not have any mortality rates, hopefully.
And we should do that with the flu too.
Well,
Same
I'm just
same
saying, this
mortality.
virus is unknown. Flu is a little more unknown. We have vaccines for flu, we have ways to try to protect ourselves from the flu. We have not come up with a vaccine for this. We don't know how this may turn out. So there's a lot of unknowns that we need to deal with and move through this process and try to protect the community. That's our goal here, is to help.
But we know the flu kills tens of
And
thousands.
just one last question, I know we probably should move from public comment to the next one. But with the flatten the curve concept, the goal is really to pace ourselves through the medical system.
Correct.
That not have a spike of the population go into a medical facility.
If you-
We're supposed to try to find a way to orderly go through the medical system.
If you took the percentage that they expect that would be hospitalized, even if you do that risk stratification or you use whatever the CDC guidelines and things there, that would rapidly overwhelm our system.
And it could be with the people that Annie's concerned about, which are gonna be those over 80 people that could maximize the system by having a lot of people that age. But we're also seeing people who are my age or younger who are becoming systematic here in Montana, correct?
Correct, yes. We've had a number of 20-year-olds of the recent cases in
About
Montana.
a quarter of our current cases are
Yes.
in their 20s.
But they'd have to have comorbid conditions,
okay,
which
if you-
you don't have.
But, yeah, so not to debate it, not to debate
The
public
discussion
comment.
part, and let the presenters present your, and then we'll have more of this discussion before we. Thank you.
Thank you so much.
Hi, I'm Dr. Doug Nelson. I've been a practicing physician here in Kalispell for 28 years, and I'm the Chief Medical Officer at Kalispell Regional Healthcare. And I'm here, we've had a robust discussion already. I'm here just to add a couple of additional points. I won't speak too long, I promise. I just want to point out, and I'm very much in support of this effort at social distancing that you all are considering today. We're fortunate in Montana to be, worldwide, one of the places that this epidemic is hitting the last. And so we can take the example that's been given across the world and across our country in terms of making our decision. And I would like to point out that there's no question that it is the consensus across the vast majority of experts in the field, internationally, nationally, statewide, and locally, that social distancing and reducing the spread of infection early in the epidemic is the way to prevent overwhelming our healthcare system. That is what we've been spending the last month or more in collaboration with the health department and North Valley Hospital, and in particular, over the last 2 weeks, we've been planning for a potential epidemic and how we're going to handle that as a healthcare system, in particular with regard to hospital beds, ventilator management for the really sick people, avoiding the peak of cases and so-called flattening the curve, as has been described here earlier, to try to spread out the number of cases, however many we may have, and avoid overwhelming our healthcare system is the objective in this. We're also making extensive efforts at Kalispell Regional Healthcare, as they are nationally, to very much save hospital beds, save resources for these patients that we're all expecting, and we're making profound efforts to try to reduce the spread of infection amongst our patients at our various facilities. We've canceled elective surgeries. We're very much limiting non-essential, non-critical appointments for patients, because we don't have to just take care of the COVID-19 patients. We have to take care of everything else that happens all the time to our community. And so I think it's vital, honestly, as a medical provider and as somebody who's involved in our local efforts to do this, that we do everything in our power to limit the spread of this epidemic before it's beyond control. And I'd be happy to answer any questions that you might have. Induced silence, way to go. Pardon?
That might come out in the discussion.
Okay, sure.
Anyone else who?
You want me to go up there? Are you recording this?
Yes,
Yes.
we are.
Then I gotta go up there.
Yeah.
Sorry.
Just state your name for the record.
I'm one of your lowly commissioners, Phil Mitchell. Good afternoon. Couple of thoughts here, real short. I want you to know that I have been inundated with calls, and we've been trying to figure out, how you guys are handling this, how Hillary's handling this, and I think what the public's trying to do today, looking at us seriously, is what are we going to do, and what aren't we going to do? And I have 5 phone calls to make after this meeting today. They want to know, what are we going to do and what are we not going to do in terms of Hillary can do this without you guys. I think she might be looking for support from you guys. I don't really know, but I need to be able to tell the public, what is the health department going to do or not do? Is what that's what I'm responding back today for. I'll let you know. I think a couple thoughts. Part of the reason I think the data that we're fighting over here is because there has been minimal testing in the United States, because we don't have the test. We aren't able to test anywhere near the amount of people we need. So I think the data that we're talking about is worthless. I'm sorry. We don't have a big enough data to do it when And so we're not able to test. So we really don't know how many people are walking around daily with this. We have no idea. I mean, I looked at a report from yesterday to today. It went up 15 to 1,800. It might go up 5,000 next week. It depends on when you're gonna start testing more. And so that's one issue. I know you guys are looking at the curve. You guys understand the curve. I understand the curve. I would like the curve to be as low as possible. That's the goal here. We can either work through this, help hospitals not be overdated, do a low curve, or we can spike like Italy, and you're reading every day what's going on over there. What's our choice? You guys are asking to have a choice today. I'm asking you guys to make a decision today. Probably the hardest one I've had is I have 6 phone calls to make after this meeting today to restaurants. It involves 228 employees. They're asking why are some restaurants open, and we've chose to follow what we feel you guys are trying to tell us to do, make personal sacrifices, close our businesses. How about the people who are staying open? You said they're wondering, should we just turn around and open up tomorrow? Because you're not gonna do anything, fine, we'll start opening up, because they aren't able to afford to pay these people time off. And I know the government, our wonderful government, is gonna try to figure out how to pay these people. We'll see how it works out. I think in the end, they're gonna lose. So I want you to know I have 6 restaurants waiting for a phone call today. And, I said that I think Hillary is trying to make the best decision she can, but at the end of the day, she doesn't need your support. And that's why we put her in this position. And I do trust what she does. I think that's about it. I do worry about how our hospitals are gonna be able to handle this if we don't follow a procedure, I guess I'm gonna say, that is different from Italy. We've seen what Italy does. Is that what we want here? There is a way to help not make it the same, and it's gonna hurt everybody. But if everybody doesn't hurt, then we're not doing what we need to do. That's it. Thank you.
Thank you.
Thank you.
Any other public comment? Okay, Hillary, the update, coronavirus.
Okay, coming up here so everyone can see me, because I can't see where I was standing. Before we finish public comment, I just want to put a couple of things in the public comment record. I've received 1 website contact, 2 emails, and 4 phone calls. Those are what's come directly to me, so I can only speak on that manner. All of them were in favor of issuing an order. In addition, I do have the emails that have been going on with the Board of Health, so you guys have all received copies of these, but because they were on this topic, we need to enter them into the public record. So just so you guys know, these emails will be part of the public record of today's meeting. Okay, so giving the COVID update, as you guys already know, we have no cases currently in Flathead County. There are 11 cases in Montana, 12 if you count the resident who hadn't been here. In Flathead County right now, we have 67 tests that have been completed. 30 of those have been negative, and we have 37 still currently pending. We have initiated the incident command system for the county, and we are located out at the Emergency Operations Center. So we've been able, with that Emergency Operations Center and Incident Command, to bring in some exterior folks who have really helped us set this up as a public health emergency. So we've been able to utilize their expertise to get into the Incident Command system and start to structure accordingly. You guys have been receiving our incident action plans, but the primary things we've been working on are public information and coordination with the hospitals. So where we're at with public information, we do have a public health nurse line. The hospital has also opened up a patient line. So what we're trying to do is separate people out if they have symptoms or things they want to talk specifically about medically, to get them to Kalispell Regional. If they want to talk about other things, and we are getting lots of questions just on what does travel look like, you know, different questions people just have about COVID in general. We're having our public health nurses take those questions, so we take away and can kind of share the load on what we're getting from the public in terms of questions. Kalispell Regional and North Valley Hospital have opened up 2 testing centers, and I think those are fully operational.
As of today.
As of today, perfect. And so that's really helpful to us. We have, per the state and CDC, public health has to actually approve every test that is completed. So as you can imagine, we've been inundated with calls from providers to discuss whether or not somebody should be tested. So this is actually going to be a big assistance for us. We have worked with the hospital to set up what the guidelines are for those testing centers, and it has allowed us to say we're okay with any tests that come out of the testing center because we have jointly agreed on what the criteria for that will be. That opens up to us some additional staff time, particularly in nursing, to be dealing with folks in the public who have questions, concerns, fears about this whole piece. So that'll be really positive for us moving forward. We're spending a lot of time on public information, not only from the press release side of getting some information out, but a lot on social media. So making sure we're getting correct information out about COVID, making sure we're supporting the message that the hospitals are sending out. And then in addition to that, just trying to help folks find new and innovative ways to deal with what's going on and what self-isolation looks like and things they could do, for example, on St. Patrick's Day to celebrate it at home and be safe. So we're trying to kind of walk that line between information but providing some creative and fun things too for the community. We do have a lot of separate groups that we have set up that we're liaisoning with. And for example, the superintendent of schools, we've worked with them to really create just one contact for us within that superintendent group, and then they're communicating themselves to make decisions. We've done the same for emergency medical services and law enforcement. So, and there's a few others too, the parks, like Glacier National Park, Forest Service, etc. So we're trying to kind of take all the questions that are coming in, put them together in groups so that we can answer the questions at one time, have one primary person that we're communicating with so that we're not being pulled in a million different directions. I think that's it. What questions do you have for me on COVID updates?
I guess I have a question about
Yeah.
3 things. The Meals on Wheels for seniors, the
Yep.
meals for the homeless people,
Mhm.
and the meals for the kiddos, the school.
Yep.
Those are the 3 things
Yeah.
I kind of wondered.
So I can answer, I think, hopefully I'm correct on all of them. The Meals on Wheels is still continuing. We've had conversations with Agency on Aging. They are just putting in place some kind of ways to make sure when they don't need to make direct contact, if they can leave it on, at the front of the house when they can't, to do minimal contact, do gloving, do things like that if they have to come in contact or go into somebody's house. So they're still continuing that as is. We have received a lot of information from the community with folks willing to volunteer for assistance with those things. And so we've actually been passing on those volunteer offers as we've received them to some of these agencies that we know are really having to change the way they do business. There is a group, so in terms of meals for the homeless, we have a couple things going on there. We have been in contact with Feed the Flathead, and I know that they've been altering the way that they're providing meals so that they're more of a box lunch instead of a hot lunch, so that they're not doing a gathering place for those. And then we have also been working with the shelters in town, and I think that's an area that still requires some additional work. And they're looking at setting up some meetings right now to make sure they're consistently on the same page and ensure that they're doing what they need to do to help stop the spread. The schools are still offering free meals. They've publicized that pretty well. I'm not sure I have all the details on it, but I know that that was one of the first discussions the superintendents had as soon as the school closure occurred. Yeah, you probably do know way more than me.
Additionally, free meals will be offered through a waiver to any school child who wants it, not only those who qualify for free or reduced lunch, which is a real positive.
Yeah.
about the kiddos who don't have transportation to the schools? Have they,
I don't know the answer to that, Mike. Have you heard of anything?
There are discussions as to how those needs will be met, but I haven't talked to them.
Yeah.
okay.
So what is the time frame right now for, I don't have a kiddo in school, so what is the time frame right now for the school closure?
So as of right now, what the governor has announced is through March 30th that they would start school Monday, March 30th. That is the current date that is out there right now.
Good luck with that.
Yeah.
Any other discussion, questions for Hillary? Okay.
Okay.
We'll move on to,
I do have a question for one of the doctors.
okay.
I'm curious as to how many beds we have between Kalispell Regional and Hospital in Whitefish.
Right, it depends on how you define beds. We basically have about 200 acute care beds between all our facilities, KRMC, Health Center, North Valley Hospital, if we really stretch it out. That doesn't include Pathways Treatment Center, which is a psychiatric facility. It doesn't include the Brennan House, which is a long-term care facility. So somewhere in the neighborhood of 200 beds that we could recruit. We've been actively planning for what do we do if we have 40 people that need to be on a ventilator. We have 18 ICU beds at Kalispell Regional. We've made contingency plans for that circumstance, and it's going to be a huge stretch on our system, but we're making plans for how to deal with it if that occurs. Just to reiterate, we very much would prefer that not occur, so.
And as a follow-up, what is your average daily occupancy of those 200 beds?
It varies during the week. It goes down on the weekends to somewhere around 75% and is sometimes over 100% at other times, in particular peak seasons during the summertime.
So you're somewhere between 70-80% easily on any given day, not counting.
And again, we have stopped all elective surgeries, joint replacements, other things that require hospitalization to basically get those people out of keep those people out of our hospital so we're ready for a potential epidemic of COVID-19.
Thank you.
Yes, sir.
In the news yesterday, again today, was the Navy has dedicated two of their hospital ships. I believe going to New York. There are 1,000-bed hospitals. The other services have mobile hospitals. You've all seen MASH. PS and MASH is surgical. Changed it to V for virus. We have facilities around here from the fairgrounds that would provide shelter. They wouldn't have to put up tents inside. Have you contacted the governor of the National Guard or any other military units to supplement the beds that you have available now?
We have not done that yet. That's the governor, as you know, has declared a state of emergency in Montana and is mobilizing some of those resources. We've thought actively about where else can we house patients. Certainly the Summit tennis courts is an example. If we're really stretched, the whole Summit exercise facility. We have other buildings on campus, several churches where less acutely ill patients could potentially be housed.
Are you required to go through the governor? We have a reserve unit here that is a supply unit. I'm sure that they could, if they were authorized, mobilize just about anything you needed.
I don't know the answer to that question. I imagine it
It
requires.
would need to come from the state.
Yeah.
It would need to come from the state, yes. We couldn't locally make a decision on any of the reserve or others.
Can somebody update us on long-term care facilities? That's something that we really are passionate about on this board. Just want to make sure that there are actions being done with the long-term care
I
facilities.
can speak to outside if you want to speak to Brendan House.
Yeah, for the Brennan House, our KRH affiliated facility, we have stopped all visitation to Brennan House. Our patients do have access through FaceTime and other media to communicate with families, but because that is such a remarkably high-risk population, as evidenced by what happened in Washington. We've cut off all visitors to that facility. Also, throughout our facility, we're screening patients, visitors, and employees before they can enter the facility. Do you have a fever? Do you have a cough? Are you short of breath? Taking temperatures now as they enter the facility, and people that fall out with those screening criteria are not allowed into the facility.
One of the calls I took yesterday was a facility, and I know we addressed this during the Norwalk outbreak earlier. They were having a person coming from California, which is a higher risk area, going to be admitted, and they have family members here, so they were looking for guidance, and I said that would have to be, an individual policy that they would have to make with their facility, with their medical director, but my judgment would have been that they would have quarantined her, made her stay with her family for 14 days before admitting her to that facility. So that might be something that you might discuss with yours, making some kind of policy about that going forward.
And we've limited that. We certainly, before transfers to our acute care hospital, we insist that the referring facility do the screening for us. Those people are treated very carefully. Even for our employees who have been out of town, this is all transpired very rapidly. We don't have any cases yet that we've identified in our valley or in the immediately surrounding counties. So we, as of today, really are instituting, if you've traveled from anywhere other than our county and the immediately surrounding counties, it's a 14-day wait before you can come to work as an employee, because you're going to be quarantined at the time you get to Flathead County. That may change if the infection becomes more endemic in our community and there are more widespread cases, but we're trying to keep it out as much as we can.
Thank you.
Last question, Brody Verworn, not practice medicine, Big Mountain Fire. Right now, some of the larger employers in the central and eastern part of the state, some of the mines, they're having kind of what Kalispell Regional and North Valley Hospital's doing right now. They're doing the setups, they're getting for CDC guidelines, they're answering questions, they're getting their temperatures checked. Now these are mobile units. There's actually people setting up outside these mines where they're getting on and off the buses and whatnot. For some of the larger employers here in the county, say the detention center, sheriff's department, courthouse, applied materials, any of those larger places, has there been talk at all to start that with some of the larger employers that are the 50 and over, to have maybe a little bit of a pre-filtration system each time they go to work, just to see, one person going in there and get everybody?
Probably the short answer to that is no. No coordinated talks about that. I can't verify that anybody's not individually talking about it as a large employer.
And certainly we would encourage, as much as for somebody like Applied Materials, if those people can work off-site, work remotely from home, that's great. We're doing that a lot at Kalispell Regional, encouraging folks not to come in if they don't need to come in.
I would like to thank the hospital, Kalispell Regional, for setting up the nurses line and the testing centers as well. I mean, that's taken a lot of pressure off of the health department nurses. I really appreciate it. That's a great service to the community.
And the other intention that we'd had with those respiratory clinics is that they would have potentially a deployable team, so that if a skilled nursing facility or something had a symptomatic patient or something that we could collect the specimens there, prioritize them for testing and things there, so to identify that particularly vulnerable population.
And I do want to follow up just on Ronali's question, because the hospital's been the one working with Brendan House, but from the non-affiliated ones, we have made direct contact with all of them. So we have not only been providing them the guidance, both from the governor, from CMS, etc. We have done phone contact with every single one of them.
Any other public comments or questions about the virus? If not, we can move on to the order of the health officer.
Yes, thank you. So what you have in front of you today is an order of the health officer. This is something that's been discussed a few times, but, what we're looking at, is ways to basically enforce what we've been providing as recommendations. So looking at all the bars, breweries, wineries, distilleries, etc., you can read all that. Closing to the public and then moving towards that alternate way of doing business. So moving towards the takeout, delivery, services, and that would include both food along with, we wanted to make sure we've included in there, like breweries, distilleries, wineries could still do if they had canned or growlers or ways that they could also promote folks not being, the tasting rooms would be closed, but that they could still provide those services. As you guys all know, we sent out a press release Tuesday morning-ish, encouraging restaurants and others to start putting this in place already. What I've provided to you is just a total snapshot, but a snapshot of the businesses that we've called, and this is by no means, I'm sure, all of them. We started calling businesses yesterday just to say, what are you already doing? And I just think that's important for you guys to know that we have a large number of restaurants, breweries, etc., that have made these recommended changes already. So this would be about moving those to enforcement for those that haven't taken the recommendations. This has come with a lot of thought and some sleepless nights for sure on my part. So I want you guys to know, so we're clear kind of on the authority of this. Officially, I do have the authority to do this as the health officer. What I'm asking for today is your support of me doing this. And so I am putting forward before you the order of the health officer, like I said, specifically asking for your support. And on that end, I have added a signature line for the board chair, so if you vote in favor of it, so that it can be shown to the public that this was supported by the Board of Health also. Questions? Yes, Bill?
Is there anything in the draft order that is not covered by the governor's order?
Yes, everything in the draft order is not covered by the governor's order.
Is this the time we have for discussion?
I don't know if you want to ask questions now, or I'll leave that up to you guys.
Should make a motion
So we
first.
can make a motion first, and then this way the discussion will be on that.
Okay, I will ask for a motion to support the health officer.
So I'll make the motion to support the health officer order and authorize the Board of Health chair to sign.
Second.
Okay, now, open for discussion.
Hillary, how did you decide on the duration for 10 days, ending March 30th?
Yes.
Just out of curiosity.
No, that's a very good question. So I chose March 30th because it's the date that the schools reopen. So in my mind, my thought process was kind of around, we need to get our community on the same page, and doing this will put us in the same page as the schools. And then if schools extend their closure date, we would relook at this accordingly. Yes?
This mandates closures of certain facilities.
Yeah.
Is there any get well provision for those that are closed if they adopt the recommended procedures?
I'm not sure I know what you mean.
Well, if a restaurant closes
Mm-hmm.
because they're not offering food through their drive-in window, they don't have one. But
They don't have to have a drive-in window. So places that have already started to do this are just doing it. You could still leave the interior open for folks to come in and pick up and pay. They just couldn't congregate and eat at that restaurant.
Okay, okay. So if they were initially closed because they don't have the facilities,
Yeah,
and they adopt their behavior to qualify, then they would be
Yeah.
authorized to stay.
correct.
Okay.
And those that have closed, I haven't spoken to any of those directly. I mean, in my mind, all of them would have the option to stay open and just work out a different way of doing business. So I'm not sure why some of them have decided to close.
In number 4, Hillary, what I had asked about was that the school meals, the senior meals, and the homeless. I didn't know, because it says who's, such as a cafeteria in a hospital, I didn't know if those needed to be added in there, or if that was just a given that, because they're not actually serving meals in-house, but so are those considered a takeout, or,
Yeah,
okay.
so those would all still be fine. What we're looking at is the congregation of
Okay.
folks
And I
in
didn't
a
know if
restaurant
schools
and
were
another
doing that. I
facility.
didn't know if the kiddos
Yeah.
were going to the school and eating. or
No,
if it
they're
was all
actually
takeout.
picking up meals.
Okay, all right.
Yes, Kyle.
And how does this affect to sort of the bakeries, the coffee shops, the drive-through coffee shops?
So they would be the exact same. They would be able to stay open, provide those services, just not have interior seating.
Thank you.
And how about hotels?
So there's nothing in here specific to hotels, probably with the exception of some that have food service. If they have a restaurant, it would fall under the same piece of this. And then in terms of like the morning buffets, we would look at the same thing of you can offer food, but not have that dining room area open for people to congregate.
Okay, and then swimming pools?
There's nothing in here about swimming pools.
As part of the discussion, as somebody who would vote no against it, I mean, I realize it's a meaningless vote, but if I could just say, hand a few things out. You know, if you start with the, you know, in logic, you take a presupposition, and based on that presupposition, the presupposition could be false, but you take steps that are based on that presupposition, and you go into error, all right? So the presupposition that we're operating on, when we're talking about tents, and we're talking about all the people that are gonna be on the ventilators, we're all gonna die, and, you know, the sky is falling. We're operating as though that's based on science and facts, and so what I have here, and the doctor said correctly that we don't have a lot of data, but the data that we have suggests that this is no more dangerous than influenza. The mortality is no greater. And I give you facts, I also give you something, you know, I mean, Ron Paul granted, he's an OBGYN, he's not an infectious disease expert. But he was in Congress from 1976 to 2013, he's a speaker of truth. And he talks about what the doctors are, and everybody's calling experts, like Dr. Anthony Fauci, who I think is from the NIH. You know, he's calling him the chief fearmonger of the Trump administration. And he says when he stood up before Congress and said, the risk of this coronavirus is, you know, 10 times that of seasonal flu. That's not science, folks. You know, so if the presupposition is this is gonna take over the world, then everything we're doing is appropriate. But if you look at the actual data, and I try as much as possible in my life to base my presuppositions on reality. The reality is not there. So, and I also included in here, a bit of a kind of an email back and forth with the MMA and some of the MMA leadership, some of the people at the top, you know, they list their data for what we know about this. And so I vote no, and I have very good reasons for it. And I think, and one of the things that I underlined here is regarding our responsibility for public safety. You know, okay, so again, if the sky really is falling, then yes, we do all these things, okay, but what if it's not true? You know, what about the food shortages that have been caused by fear when we exaggerate risk? You know, I work all day, I can go pick up food, store up my freezer, little old people living at home, they're gonna run out of food. What about the patients that are so sick that can't get in to see their doctor, which there are many cases like that. There are people that are not in the high-risk category. Those 20-year-olds, they wouldn't have even tested them unless they had comorbid conditions. So they might have had cancer, they might have been on chemo, they might have been diabetic. That's not, you know, you're probably a little over 20, but you know, that's not your average 20-year-old that's getting it, okay? These are high-risk people. So, you know, and is it medically responsible and moral to harm businesses and untold innocent people, working people, for fear of a virus with close to zero mortality? We should do it every winter because of the flu. So anyway, that's my info, and I thank you for listening.
So Hillary, I'd like to ask a question as it relates to the motion on the table. What is your intent with this order?
In terms of, I'm not sure I fully understand your question.
What is it that you're intending to do versus the
Okay,
recommendation
got it.
that we already offered?
Thank you. That helped clarify it for me. So the intention for me, I mean, we've already heard about flatten the curve, but that's what we're really trying to do as public health. I think what we're finding and seeing in the community is that as schools closed, especially this next week will be spring break, so lots of folks had already taken time off of work, that we're gonna see people still congregating in our community. So we need to ensure that social distancing is happening. I think that we have had great participation and collaboration with many restaurants and others who have taken this very seriously and have altered their way of doing business. What I want to do is move to the enforcement level of what we're recommending, so those that aren't currently doing this would be required to do so, putting us in a community where we are pushing social distancing across kind of various methods.
I have a question for Dr. Cool. So as the medical director of the public health department, is your recommendation to follow through with Hillary's order?
Yes, absolutely.
Okay, thank you.
Can I get the same answer from each of the doctors representing the community, please? What is your answer to Chair's question?
I absolutely support the order, yes.
It's Dr. Jaden, I'm in full support of the order.
And we have a couple of lead heads of departments within the health department. Is it okay to ask them to
Sure.
answer the question?
Good afternoon, I'm Christine Hughes, manager of the Environmental Health Department. Yes, I would fully support the order.
I'm Holly Jort. I manage the maternal child health programs, and I fully support this order.
I'm Carrie Knuckles. I'm the deputy health officer and a trained epidemiologist, and I fully support this order.
Thank you for responding.
How about the county attorney's office? What?
Thank you, Travis Honor, the Flathead County Attorney. I don't envy you folks and your decision. And I don't envy you, Hillary, and the work that you have to do right now. I don't have enough letters behind my name as these folks do, at least not in this particular area. So this is a case where I know there's incredibly intelligent and well-reasoned individuals on both sides of this issue. Right now, I think this is, and I appreciate the time length of this particular decision. It's going to be a significant impact on our community and our businesses. You know, we have restaurants and businesses that are operating under razor-thin margins that close even in a healthy economy, let alone in this type of situation. But to ask those folks for the next short little period of time to try and alter business, see if they can stay afloat, and then reassess once we do have a little more information, because I do think we're operating under an informational void. So with all of that and weighing out the balance, I'd like to say I abstain, but I know that's not what you're looking for. And so,
Do it.
But no, I would support this order. Thanks.
Do I have any discussion from anyone else who would like to?
I do have a couple more questions. Okay. So I'm sorry, I give a lot of consideration to this over the past few days. I actually have with me Montana Code annotated because as a member of an appointed board that's either a governing board or an advisory board, there are things that I would love to do based on my personal values, based on constituents, based on public comment. Sometimes I hear public comment and my heart breaks. I appreciate all of the restaurants who have stepped up to the plate, all of the businesses who have looked at ways that they can continue to provide services, excellent services for our community. When we had our call, I was incredibly passionate about that. And I am still completely and incredibly passionate about that. We are seeing people who are going to be hurting, whether we take action today or not. With that said, and being the person who does stay up late at night reading Montana Code Annotated, I am reminded that as a member of a board, those things that I want to make decisions on aren't really the decisions sometimes that I can make it on. I am bound, as a member of certain boards, I am bound to what Montana Code Annotated says I can and cannot do. I am bound by what local code says I can and cannot do. I am bound by what the county commissioners say that I can and cannot do. With that in mind, I did bring the powers and duty that we have as local members of the board. And if you haven't read them, it's just a really quick sheet of paper to say what we can and cannot do. I also have with me the powers and duty of the local health officer, what Hillary can and cannot do, what she's already been vested with the power to do, whatever action we take today. And so with that, I would really like if we could have one of our county attorneys who are represented to please remind us what are the powers and duties